Hello. Hello, everybody. Welcome. Welcome to our webinar session. We're going to give it one more minute just to allow some people that are still signing in. You'll see participants list going up. Thank you, everybody, so much for joining us today. Just give it a moment and we will get right started. All right, it's 2 minutes past the hour. Let's get us started today. Good afternoon. Welcome to this webinar series. My name is Dr. Melissa Mercado, and I serve as Senior Director for the Kaiser Permanente Center for Gun Violence Research and Education, part of the HAVI, the Health Alliance for Violence Intervention. We are honored to have you here join us today in this very important webinar session that is focused on problem to purpose, choosing research questions that drive change in firearm violence prevention. If we can go to the next slide. Would like to start by giving you a little bit of information about who we are. You know that gun violence in particular, is a leading cause of premature death in the United States, claiming more than 45,000 lives each year. And it is also the leading cause of death among our children and teens, according to the CDC. At our center, the Kaiser Permanente Center for Gun Violence Research and Education, we are focused on building a public health response to this epidemic. We want to ground that response in equity, because together, in collaboration with the Health Alliance for Violence Intervention, the center endeavors to transform the firearm violence research and education field, seeking a future that is free from firearm violence, where communities are the ones that lead the way. And how do we do this? Next slide, please. We do this through three main mechanisms. We partner with communities, particularly communities that are disproportionately impacted by firearm violence. We unite rigorous scientific discovery with community-led approaches, and we fund research and education initiatives that empower communities to create those solutions, those best solutions for this national epidemic. In fact, since 2022, we have awarded over $8.5 million to 49 grantees across all regions in the United States. We operate also in five key areas: advancing knowledge, clinical innovation, community building, data for action, and inclusive grant making to drive that systemic and lasting change that we seek. Next slide, please. We also produce some products that can be helpful for you. And there's one in particular that I want to highlight before I pass it on for the webinar series. This is a resource that was just recently launched last month, and it's our Prevention and Intervention Library. People at risk of or recovering from firearm injuries, they often interact with healthcare teams during critical moments, and those are important opportunities for care, for connection, and support. As such, this curated online library highlights evidence-informed, health-focused approaches to prevent firearm injury. It gives examples of strategies that are connected to healthcare settings that can help promote the health and well-being of individuals, families, and their communities by addressing those factors that increase the risk for firearm injury or death. You can access it free of charge in the link that is on the screen, KP Center for Gun Violence Research.org/interventions. Next slide. And before I go, I want to provide this QR code. If you would like to subscribe to our e-newsletter, please scan the QR code on the screen, or you can visit our website/subscribe. There you will learn about upcoming webinars and other resources and opportunities to grow and spread the word about what is new in firearm violence and firearm suicide prevention. Again, thank you so much for being here. Thank you so much for our panelists that will be sharing with us today. And I'm going to pass it on to Tom to get us started. Tom?
Great. Thank you so much, Melissa. And just welcome everyone. Thank you for joining us today. My name is Tom Simon. I'm a senior advisor for the Kaiser Permanente Center for Gun Violence Research and Education. And I'll just say I'm really excited to facilitate this webinar titled From Problem to Purpose, Choosing Research Questions That Drive Change in Firearm Violence Prevention. As Melissa said, this webinar is part of a series that the center is hosting. Next slide. And just to provide a little bit of background on the series, it really reflects the center's focus on addressing gun violence as a public health issue through evidence-based, equity-driven, and community-informed approaches. I'll just say we've learned a lot from our grantees, from the applicants for our funding, about both the research challenges that matter most to them, as well as the gaps that remain in the field. So this series is intended to respond to those priorities by providing practical information on a range of topics relevant to firearm violence prevention. So importantly, this series is part of our broader effort to really bridge the gap between research and practice, and we're excited to share this information with you and hope that it will support your work. Next slide. So this is actually the fourth webinar in our series, and this slide shows the full set of webinar topics. In every webinar, we bring together multiple perspectives with at least two speakers, and they reflect on both research and practice. And we think that this balance is just critical because our progress as a field really depends on a strong connection between research and action. And I want to say I'm honored to co-lead this webinar series with Dr. Ruth Abaya, who serves as our senior clinical advisor. And Ruth and I are both especially excited about today's topic, which focuses on how to work with communities to identify research questions that are meaningful to them, that address key gaps, and are feasible to answer with available resources. This webinar builds on prior webinars in the series, including our February webinar, which focused on building trust with communities. And we know that all too often, researchers have a tendency to want to swoop in to communities with a preconceived question rather than working with them to develop a question that's relevant and meaningful. As a center, we're committed to doing research in ways that are equitable, respectful, and community informed, and we want to support others in doing the same. Next slide. So I'm really pleased to be joined today by three outstanding experts who have agreed to share their experience developing research questions that make a difference. So I'm going to briefly introduce each presenter now to avoid interrupting the flow later. So first, let me start by welcoming a leading voice in the field, Dr. Ali Rowhani-Rahbar. Ali is the Bartley Dobb Professor for the Study and Prevention of Violence and Director of the Center for Firearm Injury Prevention at the University of Washington. He evaluates community-based interventions, social programs, and public policies for their impact on multiple forms of violence, with a focus on preventing firearm-related harm. He serves as a member of the Black and Brown Collective for Community Solutions to Gun Violence, the board of the National Research Society for the Prevention of Firearm-Related Harms, and he's on our advisory committee for the Kaiser Permanente Center for Gun Violence Research and Education. I want to share that in recognition of his research on firearm violence, he was elected to the National Academy of Medicine in 2023. And next, we're very fortunate to have with us today Durell Green. Durell is the Choose 180. He's the Choose Freedom Program Manager at Choose 180. And Durell is a community cultivation advocate. He shared with us that his lived experience as a child who was funneled through the school to prison pipeline is the main motivating factor behind his work in restorative practices with Choose 180. He believes strongly in learning and recovering from mistakes, the resiliency of our youth, and the power of choice. Durell envisions a world where systems and isms do not rob young people of recognizing and operating in their gifts and their purpose. His passion led to being appointed to serve for 6 years on the Washington Statewide Reentry Council to help inform policy. And finally, I'm really looking forward to hearing from Christina Umali. Christina is the Teaching and Advancement Project Manager at Choose 180. Growing up, Christina witnessed many of her peers and family members impacted by incarceration and gun violence. At 21, she experienced firsthand what it was like to navigate the criminal legal system. This turning point inspired Christina and her dedication to supporting individuals and families affected by incarceration. After being incarcerated herself, she went on to earn both her bachelor's and master's degrees in public health from the University of Washington. Grounded in the belief that representation matters, Christina is committed to showing youth that there are many pathways to success and that their voices, resilience, and brilliance can drive meaningful change. Now, I know that if we were all in a big conference room together, there would be a big round of applause right now as we get to welcome our presenters. I know we're very excited to learn from them. I want to acknowledge my colleague, Tammy Sakala-Stasel, who's handling the technology and the slides for us. She's going to transition now to the presenter slides. And we're going to hear from all three presenters, starting with Ali. And after that, we'll have some time for Q&A and discussion with the panel. So for everyone joining today, please feel free to submit your questions at any time using the Q&A feature. With that, let's get started. I'm going to turn it over to you, Ali.
Great. Thank you so much, Tom. Please let me know if you can't hear me or any audio video issues. Thank you, Tom, Ruth, Melissa, Tammy. Really honored to be here with you all and with Christina and Durell and learn from their lived experience and wisdom in this space. To maximize time that we have, I think we can just jump in. Please, next slide. So one of the most consequential decisions that we all make in this space, in this work, happens before we write our first question, essentially. That decision is, am I doing research or am I doing program evaluation? I can't tell you how many times we have thought about this. We have dealt with this with our own research team. I'm pretty sure that has happened to you all as well. And these are not the same thing. They are not interchangeable. Research is oriented toward generating generalizable knowledge. We want to know that whether something that will be true beyond this particular site, beyond this program, beyond this year, while program evaluation is oriented toward improving a specific program. We want to know whether what we are doing is working and how to do it better. The practical differences between these two is really significant. Sometimes we ignore it or we're confused about it. Research requires IRB oversight because we are generating knowledge that will affect others beyond the participants. Program evaluation often falls outside that requirement. Both of these are necessary, but conflating them causes real problems and real challenges. Programs get subjected to research standards that were inappropriate for what they were trying to do, and important research questions may get muddied because the design was built for program improvement. I remember a couple of years ago, our team and I were going to get a certificate of confidentiality from the NIH for one of our projects, and there was a drop-down menu required to really indicate that this is research and to upload our IRB approval. And so that's a good example of making this decision, whether this is research or program evaluation, because it has real-world consequences in terms of what it comes next. Next slide, please. And so there are two different lenses here, right? Both of them are important. A program goal might be something like this: reduce shooting in this neighborhood by 20% over 1 year through this specific CVI, Community Violence Intervention Program. That's not a research question. It's a program aspiration. A research question might be something like, what's the effect of a CVI program of this particular type on a 1-year risk of shooting among its participants? Next slide, please. And so once we have decided we are doing research and we have a general topic, the next task is sharpening that question until it becomes answerable. Right? So one framework that people recommend is the PICO framework. What exactly are we talking about? A population for research question has measurable indicators: age ranges, geographic boundaries, racial, ethnic composition, exposure history. The more specifically we define the population, the more clearly we can design a study that will reach them and produce findings that are applicable to them. What is being studied? If it's a program, which components? If it's a policy, which specific provisions of the policy? If it's a social condition like unemployment, how are we measuring it and at what level? What would have happened without the intervention or exposure? This is where some community-based research struggles, and we have struggled. I know many of you have struggled because finding a true comparison group or control group may be unethical, may be infeasible. So what do you do about that? Who do you compare it with? So we still need to think carefully about what we are comparing it to. A different site, a wait list, a historical baseline, a matched sample. What is the basis for that comparison? Does that make sense? Is it even ethical? And so critically, is that what matters? This is where community input and community engagement really becomes really, really important. Next one, please. And so consulting communities, as many of you know, many of the audience here are extremely informed, well-informed, with a lot of rich experience. And you have seen in Kaiser series in the past as well, in the past 3. Consulting communities after we've already designed the study is just too late. It's not community partnership. It's community relations at best, and it's extractive at worst. Genuine partnership means communities are shaping what we are asking, not just validating what we have decided to ask. There are 3 phases in this journey, right, where engagement really matters. Before the question even exists is when we need to be building relationships and listening. What do community members think researchers have gotten wrong? What questions have never been asked that should have been asked? What research has been done in the community that produced nothing useful, in fact, actually harmed the community? We have to be honest about that. We have to be very blunt and explicit about that. Those conversations create trust, will reshape our assumptions in a way that matter enormously for the quality of our eventual science. During question development, community partners should be in the room, right? Not as consultants who review a draft, but as co-developers who help decide what the study is all about. What are the things we're going to measure? This is where lived experience does the most work. People who have survived violence, who work with violence-affected families, who run the programs being studied, they have the knowledge, they know the solutions, and they know the answer. And so that irreplaceable kind of knowledge is something that needs to be in the room. And also after developing the question, formalizing the partnership is the 3rd place. And it really matters a lot because informal agreements dissolve under pressure, right? So community advisory boards, memorandum of understanding, data sharing agreements, explicit conversations about authorship and that power dynamic and attribution are really, really critical in this space, and they're infrastructure of a genuine, honest, authentic relationship. Next slide, please. So that relevance we talk about sounds nice, but it's not just the box that we check at the beginning of a project. It's something that we maintain across the entire arc of the work, and it requires actively asking communities whether the research we're all doing still reflects what they need to know. There are questions we need to ask community partners at the outset of any project, and the answer consistently changes designs. What outcomes would signal real change to the community and to someone living in the neighborhood whose voices are missing from past research on this topic? What has research gotten wrong about the community? And as we all know, we have gotten wrong plenty of time. Would this research be used, or would it just be published? On outcomes specifically, as you all know, the field of gun violence research has historically been anchored to mortality, deficits, arrests, convictions, injury, because those are the outcomes we can measure easily, rather easily, and reliably from admin data, administrative records. But those are not the outcomes communities name consistently when we ask them what they want changed. Perceived neighborhood safety comes up, trust comes up, belonging comes up. These are measurable. They are sensitive to intervention effects, and they matter to families in ways that maybe arrest counts simply do not. So really having an eye on the power, the beauty, and the assets of communities is really, really important. and typically has been neglected. And sometimes the reason researchers don't measure these outcomes is not that they can't be measured. It's not that they're not measurable. It's that measuring them requires more resources, more community cooperation, more complex analysis than pulling admin data. And I think we must be honest that a lot of research has avoided this at the cost, at the expense of communities. So more holistic evaluation frameworks are needed. Key asset-based outcomes that shift the lens from what's broken to what's being built are needed. Participatory action research approaches, where community members help define what outcomes matter, are increasingly seen as best practices for this kind of asset-based evaluations. Mixed method studies are much needed, and the broader framing here from reducing violence to building community capacity for safety is also more politically durable and resonant with the communities that these programs serve. Next slide, please. And so just to end my section of the presentation today, just a couple of examples from the work that we have done in Washington State in the past several years, working hand in hand alongside community-based organizations. This is a paper that came out with all the authors as community leaders and us, that we worked together with our team to co-develop theories of change for programs that were doing youth firearm violence intervention in Washington State, and truly came out of more than a year and a half of work with community-based organizations very closely to understand what they are exactly doing, what are those levers of change, what is it that they would like to be measured. And this is a global model, obviously doesn't apply specifically to every program, but programs can adapt and change and choose from this for their own specific program that they are implementing. Next slide, please. And in one of the recent scoping reviews of the CVI literature that we did and published in the special issue of Inquiry on CVI, we look at the field, the entire field, to see the level of engagement with community. And you can see here that CVI evaluation papers that were published that explicitly mentioned that they engaged and involved community-based organizations, or they answered our survey because we asked them whether they involved community or not. They are on the rise, which is good news. At the same time, there is still a lot of room for improvement for directly engaging community and community voices in this type of work. So while the trend is promising, it by no means is where it needs to be. Next slide, please. And this is my last slide. I just wanted to draw your attention to this resource that we have created working with community members, this CVI measurement toolkit. I would love for you to please take a look at it. I would really appreciate if you test it, if you tried it, to see whether it speaks to you, whether it's relevant to the work that you do. And please send me your comments and feedback. We'll be delighted to modify it as needed. Our team has been working on this really hard for the past couple of years, working with community-based organizations in Washington State, where these measures have been essentially derived from those conversations with community-based organizations for the constructs that they care about. You can choose whether you are going to design a qualitative interview, you want to do a quantitative survey, you can choose the constructs, specific constructs that you would like and matters to you, and then a series of questions will emerge that you could download to, for example, a Word document or something like that. This is important because as you do research, as you go through the conduct of research, sometimes your next question comes up. You're doing current research and you think with yourself, well, this is an interesting question. Maybe I'm going to answer that in my next research project. So the idea of research question and scientific question that you have in mind for evaluation is always something that should be on our radar throughout the conduct of this study. It's not just something that you do at the beginning and then you move on. So in closing, I would say that the research question that we choose is a values act. It should be driven by our values. It says this is what matters enough to a study. This is whose experience counts as evidence. This is what change looks like. If we choose the question purely because it's easy to fund, or because our methods happen to be well suited for it, or because it fits neatly within the existing literature, We may produce good science. There may not be anything wrong about that scientifically, but we are not going to be studying what actually matters, what needs to be studied, what moves the needle. And in a field where communities are living with real violence and real loss and real pain and real suffering, that gap is not abstract. It has meaningful impact on people's lives. So with that, I'm going to hand it off to Durell.
Really appreciate you laying the groundwork right there, Ali. Privileged to be working with you. Good morning to us on the West Coast, and good afternoon to everybody else. Um, I'll be brief on the intro to Choose 180 just so that we can really focus on the topic at the hand, developing the research questions. Quick overview. Our kind of what we focus on is transforming systems of injustice and supporting the young people that are impacted by those systems. We work with young people from the ages of 12 to 24, primarily in King and Pierce counties, where the majority of the population in the Puget Sound area in Washington state is at. And most of our staff are BIPOC, people with lived experience. And we can go to the next slide. This is a brief snapshot, kind of where our organization has infiltrated this school to prison pipeline. And we originated as a court diversion program where we were getting low level offenses before they would be filed, they would be diverted by youth participating in our programs. And then we extended that to young adults, and we just kind of grew in an organic way, starting at that position. Something fundamental to the DNA of Choose 180 has always been our partnerships, our strategic partnerships, and that's how we transform systems. And that's relevant today, because of the partnership that we're talking about doing with researchers. There's really a bi-directional disconnect there a lot of times. Before I had the pleasure of meeting Ali, we were having the conversation, and I had some implicit biases, even though I've taken part in doing research with uh, with other people. I'm always like, well, who are these people coming and asking these questions? And they want me to use my credibility in the community to talk to some kid that just got shot about this. And so I was very distrustful, because you kind of always get this picture in your mind of like, who are these people somewhere in this lab? And, Ali was able to share with me that there's a whole bunch of people of color that actually do this. And I think that the assumption usually is like, there's like old white guys in lab coats somewhere that, just have nefarious intentions with these questions doing research. And so strategically partnering with people that do research is very much in the DNA of Choose 180. I work at the program where we strategically partner with facilities. And so we go inside of the prisons, and we also do our gun violence intervention program. So that's my particular field of expertise that I bring representing Choose 180. And I will let Christina, introduce the other part that really does a lot of the actual partnering and research special projects, which is the TA. But we do have seven programs in total that go into the schools that offer counseling for free with no insurance, and aftercare services, caseload management, all those type of things, with the intention of disrupting the school to prison pipeline. Next slide, please. And this is our Choose Freedom overview. It is a 14-week curriculum. The curriculum was written by people with lived experience, so it's not something that comes from a perspective of not knowing what it's like to go through gun violence and not knowing what it's like to be incarcerated, and some of the hard to quantify things that of impacts that can have on the psyche of an individual that's experienced those things. So the curriculum, the very DNA of it is lived experiences involved in that. And we really want to mitigate the impacts of gun violence, mitigate the impacts of incarceration. There's a theory, post-traumatic growth, just to where we can acknowledge this PTSD is a real thing. We focus on the possibility of transformation through trauma, from trauma, and just giving people real practical, real life tools of how to overcome these traumatic situations. Uh, Next slide. And
Also, oh, go ahead, Durell.
I'm passing it to you.
Okay, cool. Um, Also, Durell loves to be humble, but I want to give him his flowers. He is the main person who wrote the curriculum that he was just talking about. So I love to highlight him when it comes to that. Thanks, Ali. Thanks, Durell. We are so grateful to be here today and be in community with y'all online. And if you missed the intro, my name is Christina, and I'm a project manager on the teaching and advancement team at Choose 180. And you might be thinking, okay, what is teaching and advancement? And really, it's a fancy way of saying that my team gets to do a lot of different projects depending on what the ask is. The team was created because folks from the system and the community side, they saw and or heard about the work that we do, and they're like, you know what? That's cool, and we could benefit from getting some support from y'all. We offer trainings and workshops to system and community folks. And also, lately, we've been providing just comprehensive research support. So, collaborating with folks on the planning, facilitation, and analysis of their project, but really only if the project aligns with us. And our ultimate goal is really just trying to help other folks strengthen how they support and advocate for their young people. Since the creation of this team a couple of years ago, we've provided restorative practices trainings to school partners, presented at a few national conferences, have collaborated on 3 research projects just this past year, and probably have conducted more than 100 interviews and focus groups. And what I think is really cool about this team is that not only do we have the technical skills to do this work, but also we have the lived experience of being formerly incarcerated or impacted by gun and gang violence, which I think is rare in this field. Also, Durell used to be on my team, but is now managing the Choose Freedom program. So that's what brought us together. Also, we're currently working with a team from Amazon who's helping us build a learning management system where we're going to have some online modules for folks who are looking for resources and want to learn our formula and our secret sauce when it comes to supporting young people. So, if you're interested and think you or your organization could benefit from something like this, you can go to our website and sign up for our newsletter for any updates. Also, sorry, I didn't put our website on the slide, but it's choose180.org. And I can also drop it in the chat later. Next slide, please. But now we're going to jump right into the main focus of this webinar and talk about how we develop meaningful research questions, especially when studying complex issues like gun violence. And first of all, I want to emphasize that research should begin with lived experience and not just data, right? We all know that data is super important. It can show us patterns, trends, and disparities. It tells us a lot about what's happening, but data alone rarely tells us why things are happening and what exactly needs to change. And that deeper understanding often comes from the community itself and the people who are living with the issue every single day. So before even forming a research question, we need to ask some basic, but very critical questions. What does gun violence actually look like in this community? Who is most impacted? And what are the ripple effects of gun violence in this community? And when you start and ask these types of questions, it moves us beyond the numbers and towards understanding the real conditions that people are experiencing. You know, Ali said it earlier, but when research questions are developed only from academic literature, they focus on the gaps in the literature. But when they're grounded in community realities, they focus on problems that people actually want solved. And that shift matters because research questions should emerge from real conditions and not just academic curiosity. Next slide, please. Okay, so now that you've asked those previous questions, Hopefully, you've had conversations and built trust within the community and just deeply understand the context of the community that you're working in. The next step is focusing the question. Strong research questions, they're specific, they're actionable, and they're connected to real change. And again, I have some more questions for y'all to think about, but it always helps to pause and ask, what problem are we actually trying to solve? Who benefits if this question gets answered? And what decision will this research help inform? You can also take it a step further and ask, who specifically are we focusing on? Where is this happening? And what kind of change are we hoping to see? Because sometimes a question like, how do we reduce gun violence? It's too broad to act on. But if we narrow it down to something like, what strategies are most effective in reducing youth gun violence in X community? Now we're getting somewhere actionable. And it's also important to think about feasibility, right? Do we actually have access to the information that we need? Can this question be answered within our time and resources? Are we approaching this topic in a way that feels respectful and safe for the community? And when you reflect on all this, it keeps the research grounded in purpose and impact. And there might be times when we reflect on who benefits or what decision this research informs and whether the question actually reflects the community priorities. Sometimes you might realize that the question still needs work, right? Maybe it's too broad. Maybe the community's priorities aren't reflected, or maybe the findings don't lead to to real action. And these moments are signals that it's okay, but it's also necessary to go back to the drawing board and really refine the questions so the research can just truly support meaningful change that benefits not only the researchers and the academics, but also the communities and the people that they serve. Next slide, please. Um, and ultimately, this just brings us back to why community engagement has to happen early before the question is even finalized. And right, I'm sure y'all have seen this before where engagement happens after researchers have already defined the project. And at that point, the community is being asked to give feedback on something that's essentially already decided. But true collaboration looks different. It involves co-design, where community partners help actually shape the research itself from the beginning, including the questions being asked. And it's really important to remember that co-design isn't the same as consultation. Consultation is when you're asking for input, where co-design is really sharing power in the decision making. That also means recognizing the community members as experts. It means compensating them for their time and knowledge and making sure that they have a meaningful role in shaping the work and not just reacting to it, because the goal is to build research that communities actually see as relevant and useful, right? Because if the community doesn't see themselves reflected in the research question, it's going to be so much harder for that research to lead to real change, period. And at Choose 180, we like to say that all money isn't good money. And there have been times in the past when we've turned down projects because the priorities didn't align, or maybe because the questions being asked could cause harm to our staff and or the young people that we serve. So again, I always want to emphasize when communities help shape the questions, the research is far more likely to produce insights that are meaningful and trusted and actionable. And that's really the goal of this kind of work. It's not just generating knowledge, but generating knowledge that leads to real improvements in people's lives. And before we go on to the next slide, I know Durell wants to drop some gems for y'all.
Yeah, this is just very much in line with the slide that Ali had earlier about when to engage with community when it comes to coming up with the questions. Oftentimes, if we're included just in this beginning, this middle part of, hey, we have these questions. What do you think about these? We can read those and immediately uh, a lot of questions feel like you know what answer that they're looking for already. And it feels like they're trying to lead questions a certain type of way. And it'll cause us to be distrustful right there at that point. Whereas if you engaged with us before you were asking the question, and we understood where the end goal was, then maybe you wouldn't have asked these questions this way. And sometimes it's hard to assume that they just have the best intentions when they ask something that just seems kind of borderline disrespectful or not sensitive enough to the community. And they honestly could just be making a mistake there. And so coming before you've developed the questions is always recommended. Um, Tom, you popped up. Was that for oh, okay.
Oh, sorry about that.
I wasn't sure if that was the hook.
I'm not pulling you with a hook or anything, Durell. Keep going, please. You're good.
Tammy, next slide, please. So, what does this process actually look like in practice? Well, last year we had the opportunity to partner on a research project with folks from Ali Center, the University of Washington Center for Firearm Injury Prevention. Also, I want to give a shout out to Christian, Jeannie, Vivian, and Miriam. But this is a great example of everything that we've been talking about, right? We already had a relationship with folks from the team, so there was that borderline trust there. But even with that foundation, they didn't come in assuming alignment or expecting us to even automatically say yes. Instead, they approached us with curiosity and transparency. They said, you know what? We have some funding. We're interested in exploring alternatives to youth detention, especially in cases where a firearm is involved. But they didn't stop there. They asked, what do y'all think? And that wasn't just a one-time conversation, right? We had multiple meetings early on that were just about asking questions, sharing perspectives, and gathering information from each other before anything was finalized. And they were also very intentional about making sure that there was alignment. They asked things like, does this reflect your priorities? Would this benefit your community and the young people that you work with? And also, do you have the capacity to do this work together? And I specifically want to focus on capacity for a moment, which I think is a big thing folks should think about when wanting to collaborate with a community partner. More often than not, folks in nonprofit spaces are already spread thin with limited resources. So if there isn't someone who necessarily has research experience on the team, you got to think through how are you going to help build that capacity. Luckily, I do have research background. Also, Durell has experience with facilitation. So we were fine capacity wise for the project, but also like I'm still very early in my career with a lot to learn. Um, but going back to what I was saying about the project team, they didn't move forward until everyone was on board. They were also transparent from the very beginning about how the information would be used, which I think is critical for building trust and is also a big deciding factor on our end on whether or not we will work with folks. So from there, this truly became true collaboration, textbook collaboration. Together, we helped shape and refine the main research question, which focused on what alternatives to youth detention could look like and whether those alternatives shift when a firearm is involved. And our role didn't stop at the question. We co-developed the focus group and interview guides, helped facilitate those conversations, and we're also involved in the transcription, the coding, and analysis. And even throughout the project, we had recurring check-ins just to make sure that we stayed aligned, we addressed any concerns, and that, whether we had to adjust. So this wasn't participation, it was shared ownership from start to finish. And that's the difference. When you approach research this way, you don't just get better data, you get insights that are grounded in real experience and much more likely to lead to solutions that actually work in the community because let's face it, the people closest to the issue should be closest to shaping the solutions. And if you are someone like me or Durell who do have that lived experience and do this work, I just want to tell you that you are heard, you are seen, and you deserve to be in these spaces and at the decision-making table. And with that, I will let Durell end us off.
Yeah, that was a great experience working with them. Even there was times during the research where Christina and I had actually did focus groups already, and we went back and they realized like we didn't get what we needed out of that. Our questions weren't specific enough, and so real time, we came up with the idea to develop some scenarios to ask the young people about gun violence that they would be able to understand and relate to. And I was able to just come up with some, not off the top of my head, but kind of just because I have that lived experience, I could create a scenario and present it to some young people. And we were able to get great feedback about gun violence and the impacts that it had in their community. So it really was a great partnership from start to finish. The last thing that I really would just say when we're developing research questions, we have to be honest if we're going to be ready for the answers and willing to act on wherever the research leads us. And I say that because we had the opportunity to work with some of the students that were impacted by a high school shooting up here at Garfield. And we had to have a real conversation with them on the side because people want to amplify the voice of the youth, but usually only when it amplifies the narrative that an older voice wants them to have. And a lot of them were saying that, in response to the shooting, they wanted to have more police presence at the school. But a lot of older people, even myself included, will feel like that's not the answer that we want. So we're not going to highlight that the youth are going to say that. And I think that real research needs to be, it doesn't matter, what the answers is. We're going to take that. We're going to work with that, even if it's not what we were looking for, not what we expected, not what we wanted. But that's how we go from just doing research projects to actually being impactful, is just going where it takes you. And that's an unfortunate thing that I see happen a whole lot when we're trying to look into things like this. Is people think they know the answers already, and they're just looking to get that answer from somewhere else so they can justify doing whatever it is that they want to do. And that's not research, that's manipulation. Something else probably worse.
And yeah, thank you again. I think we're ready for questions. But Tom, I'll let you take the talking stick.
Christina, Durell, Ali, thank you so much. This was excellent. Thank you for sharing your personal experience, your professional experience with us all. You've given us a lot to think about. I love the distinctions you made between community relations versus true community partnerships and co-design work. And Durell, I liked what you said about PTSG as well. I hope to hear more about that. So for everyone who's joined us, I want to make sure you know to please go ahead and put your questions in the Q&A box, and we're going to try to get to as many as we can. We've had some questions come in already, and I've got a few questions that I would like to start with. Ali, the first question is for you. I was wondering if you could elaborate on how you've seen research questions and program goals diverge, and how you ensure that you can advance both community priorities and what funders want, especially when they differ from each other.
Exactly. Thank you so much, Tom. And I see a question actually from an anonymous attendee that also touches on that, which is that we need to highlight and center the priorities of the community. At the same time, we need to be realistic. You need to get the money and the funds to be able to do the work. And so how do you reconcile that when funders and researchers operate on grant cycle and publication timeline, but communities experience gun violence as an ongoing emergency, right? Communities often want answers to questions like, is this helping people? Is it respectful? Is it feasible for our staff? Is it causing unintended harm? Program staff may want to think about maintaining their capacity or increasing it, meet contract deliverables, satisfy referral targets. And funders often want questions that are related to measurable outcome, generalizable evidence, innovation, methodological rigor. And so there are differences for sure. And so there are some strategies I can offer based on our own work, hopefully that will resonate with you. One is that you just think about different levels. What does the community or program need to make a decision? What does the funder need to justify their investment? And when you call that out from the outset, that really makes it very clear. You could broaden your outcomes. So you could have primary outcomes and secondary outcomes, where you can potentially include both, include some of those outcomes that matter the most to the funder, but also include other measures like patient trust, retention in services, successful connection to housing, employment, staff burden, turnover, perceived coercion, stigma, racial equity in referral engagement. Those could also be outcomes that you could include in your protocol, essentially, that may help with reconciling some of the divergences. I think being honest and negotiate from the very outset, the feasibility and rigor, honestly, is really, really helpful, especially with the funder at the beginning. And to say, this is a very burdensome design. This is not going to work out in this timeline. Instead of that, we can do this. So more like a sequential, where you can say maybe for now we could do this in terms of putting the building blocks here, and then maybe we can do a pilot, and then maybe we can do outcome evaluation instead of jumping into outcome evaluation from day one. And if we define success in more than one dimension, then we can give ourselves a little bit of a breathing room in terms of whether the project has been successful or not. It may not statistically result in a reduction in shootings, but we gained a lot of other insight in terms of clarifying the mechanism, improving trust, strengthening partnership. Those are success too. Just reduction in shooting itself is not the only success measures. There are so many other success measures that we could think about. And translating community priorities also to funder language sometimes is helpful. We talk about trust, we talk about dignity, we talk about non-stigmatized care. Well, those are related to some of the things we talk about to funders: acceptability, appropriateness, feasibility, patient-centeredness. So they're not necessarily a dichotomy. There are some overlaps between them that could be really, really helpful. And I would say, just refusing or resisting this, false precision that you have to force a very neatly defined causal question into a study. It may not be the time for that. We may need to do a lot of other things first before we try to understand the causal relation between a particular intervention and reduction in shootings, for example. So those are some of the strategies we have used and successfully with understanding thoughtful partners and funders that we have had in the past 3 or 4 years to reach a place where we can still center the community priorities and still be able to secure the funding from the funder.
I love that. Ali, I do have some questions for Durell and Christina too, but I wanted to ask a clarifying question that came in for you. At the beginning of your presentation, you made a distinction between program evaluation and outcome evaluation or research. And the question is, did they understand correctly that the IRB approval is not needed for program evaluation?
Very important question. I don't want to take the entire space, and I'm happy to speak offline as well, but it is a really important question. Yes, we had multiple conversations with University of Washington Human Subject Division with our team, to their credit, in detailed conversation, in-depth conversation about the nature of the CBI evaluation that we were doing. And when it became clear that it was purely the evaluation of a specific program, the decision was made that it was program evaluation and not research for producing generalizable knowledge. When that decision was made, our human subject division in our institution said, this is not research, so it's not subject to all the institutional requirements that come with research. Having said that, including IRB, having said that, I'll just say one more thing, is that even if it does not become subject of things like informed consent, HIPAA waiver, other things that come within the package of IRB and human subject research, still it's our ethical, moral duty and obligation to do the program evaluation with dignity and honor and honesty. So still we need to go after those consent forms and informed consent and making sure privacy, confidentiality is intact, even if it's not called research.
It's a great distinction. Thank you. Christina and Durell, we'd love to hear your thoughts about how to be, building off of your presentation, how do we make sure that we're being sensitive to the needs of communities with deep trauma when developing research questions on gun violence in particular. I'm thinking about some of the challenges that we've all experienced about, the need for detailed data with the risk of adding trauma and triggering folks. But I'm sure there's others. So I'd love to hear your thoughts on that.
Yeah, Durell, I'll start us off, but thanks for that question, Tom, because that tension is real. On one hand, we do want the detailed, meaningful data, but on the other hand, we have to recognize that for many communities, this isn't abstract. This is lived experience and often tied to very deep trauma. So I think the first shift is moving from asking, how do we get the most information, to asking what information is necessary and at what cost. Just because we can ask something doesn't mean that we should. And also, when I do this work, I hold my community and those who I've lost due to gun violence very close to me. I think about my childhood best friend who was shot and killed 6 years ago, and I think about how it was spending time with his family right after it happened. So, when it comes to research and research questions, I think about how they would feel if they were being asked all of this. And with that, I'll end my response with good research doesn't just ask hard questions, it also knows when not to. Um, and Darrell, I'll let you take the floor.
Bars. We could have ended with that, but I'll really just add that community gets used as a blanket term too often. Like even if you break down your demographic and by ethnicity and age or whatever, you're still talking to individuals, and everybody's individually gonna have a different level of sensitivity to this. If you talk to a mom about gun violence that buried her son that got shot, she's gonna be a certain type of way. If you talk to the younger brother in that same family, he's gonna have a different type of reaction. If you talk to the friend, they'll have a different type of reaction. So like when we say community, we have to realize that we're still collecting data from individuals, and everybody's going to be a little bit different. And that doesn't mean you can't have a question that you ask everybody, but you have to kind of, me as the person that asked the question, I feel like I have to be bilingual and be able to ask, in the correct dialect, so to speak, each individual that I'm talking to. And so just being mindful that a lot of these things are still there might be active shooters and killers still going on. And so when you ask somebody that's in that type of scenario something, they might feel like I can't speak because there's open cases and I don't, there's potential for more gun violence to happen if it's known that I'm being asked these type of questions. So there's a lot of layers to be sensitive of, and I think like just using community as a blanket statement for everybody takes away the individualism, which research kind of do by default anyway, by talking about data points and stats, but all those stats and data points are people that matter and that have feelings. So just being sensitive to that.
Excellent. Thank you both. And we just have a couple, like maybe one last question. This is one that came in just a minute ago from Kay Mosby that anybody could answer. But all of you touched on this. The issue of co-design is not just consultation, right? And the question is, what are some of the challenges that you've experienced with co-design? If you have any like parting words around like how to overcome those challenges of co-design, welcome that.
Yeah, I can go ahead and keep it very short. One of the things that came up was the skepticism that some of the community-based organizations had toward, for example, an academic institute, and for a good reason, because of the past harm that research and academia has done. So it required some time and patience and mutual understanding to, continue to work to nurture and build that relationship and gain that trust for co-doing, co-measuring, co-developing. But it was very fruitful, and it was just such a joy to build that relationship and see the result of that trust.
Well, I just want to thank you all for the work that you're doing. You'll see what you look through the comments and the Q&A that people reflected on how important it is, how it's work that's clearly being done from the heart, right? And it's really resonating with our participants. So thank you all so much for your thoughtful approach to the work and for making time to share it with all of us. Um, I just want to end by letting folks know that we're excited to announce the next webinar in the series. You can see the title here. It's called "It's Not Just What You Do, It's How You Do It: Implementation Science for Firearm Violence Prevention." It's going to be at the end of April 29th at 1 o'clock. We've got some amazing panelists for this webinar as well. We'll get to hear from Jessica Pilardi and Sydney Roll Stern, who both work with the Domestic Violence Prevention Program at Lutheran Settlement House in Philadelphia. And we'll get to hear from Leanne Estefan, who is a former senior scientist in CDC's Division of Violence Prevention and a current consultant with Evolve Violence Prevention. So they'll be sharing their experience and expertise with us about ensuring what we do is impactful and sustainable. So we hope you'll register for that. And you'll see as we end an opportunity to give us feedback on the webinar series and this webinar in particular. We welcome that because we're looking to continue to improve. So please take a minute to do the survey. Thank you to everybody who joined us, and a special thanks to our panelists for these amazing presentations and conversation. I wish we had another hour to talk with you. This hour goes by so quickly. So thank you all so much.